And then when I met you, my husband and I got amazed with the carnivore diet and we decided to try it. And the first month, I really started feeling amazing. My skin was getting better. Since then, I practice a carnivore diet and I feel a lot of better. I don't need any pills since that time. And actually now I'm pregnant. I'm 8 months pregnant and I don't take any supplements. I don't eat iron, folate. And the GO says to me that I have to do some supplementations, but I didn't. And my blood tests are perfect. The baby is developing really great. I have a lot of energy. I work all the day. So I'm so happy with this lifestyle that I promote it also with my patients.
Good morning. Okay, there we go. So Fernanda, how are you? Good to have you here.
Hi, I'm fine. Actually so happy to be here talking with you. So I'm pretty fine. Thank you.
Well, welcome. Thank you. And you are, correct me if I'm wrong, but you're in Bolivia. Is that correct?
Yes, from Bolivia. Santa Cruz is actually my city, my town.
Okay, I haven't run into a lot of Bolivians. It's not somebody we see very commonly. But well, thank you for taking the time to do this. Would you share your background with us, if you're okay with that?
Yes. Well, thank you. I'm so happy to be here with all of you, with the community. I'm a doctor, and I've been practicing functional medicine 5 years from 5 years ago. Actually searching from the root cause of the diseases of the patients. I wasn't happy with the results I was having in my general practice. And also I was a vegetarian for 9 years. So I had a lot of trouble in my health too. So I wasn't seeing the good results with my health and not seeing good results with my patients' health. So I joined into this field to trying to look the root cause of the diseases. And that's when I got with the nutrition, where I was able to see that the things that were affecting our health, it started with what we are eating. So that's where I started my journey in low-carb, keto, carnivore diet, and using some therapies to enhance the healing of the patients. And now, well, I'm really happy to see the results.
So you said you've been practicing for 5 years as in the functional medicine capacity. Did you train in sort of internal medicine, or what was your primary care? What was your specialty of training while you were in school?
Here in Latin America, it's different than the United States because in the United States you have to have like a residency, but here you became a general doctor and you are able to practice as a general doctor. So when I finished medical school, right away I got into this functional field. So of course, I have to study a lot of internal medicine to learn more, but I graduated as a general doctor and I've been practicing since that, this functional medicine, or here we also call it orthomolecular.
Okay. And you were a vegetarian for 9 years. What led you that way? I mean, what was something I guess this would have been prior to medical school. What got you started into vegetarianism? And did your training in medical school reinforce that being a vegetarian was a good idea?
Well, I actually started the vegetarian because I have some acne problems, and that was really uncomfortable with me. But when I get into the medical school, I was doing some research, but of course, I didn't know how to do a proper research. So I got into the vegetarian studies and some doctors that were promoting the vegetarian. And I said, okay, I will try And I started when I was 19 to being a vegetarian. And I actually got a good result for the first 6 months. But then I was getting worse. The acne started to come again. After 2 years, I was getting a lot of sick. But I was so convinced that was the path that I continued to being vegetarian. And in med school, I didn't have so much time to study because, well, we have to study the things that they gave us. So I didn't study about nutrition. So I continued to be vegetarian. And when I finished the medical school, I was depressed. I was very skinny with terrible acne. I have reflux. And I couldn't go proper to the bathroom. So I really had a lot of trouble. And that's the point that I realized that as a doctor, I was acting like a conventional doctor because I go to the pharmacy, take my pills. I have terrible migraines too. So I was in my purse with a lot of pills, but having no results. I was with low energy. And I couldn't realize in my late 20s why I was like that. So that's where I started to look more, study more. And well, I find first the keto diet. And that makes sense to me when I read, when I study. But it was interesting because I went 6 months keto, but I still having some troubles, like with the acne troubles. Still have some issues in my joints, have pain in my joints. And then when I met your channel, my husband and I got amazed with the carnivore diet, and we decided to try it in 2019. And the first month, I really started feeling amazing. My skin was getting better. And that since then, I practice a carnivore diet, and I feel a lot of better. I don't need any pills since that time. And actually now I'm pregnant. I'm 8 months pregnant, and I don't take any supplements. I don't eat iron, folate. And the GO says to me that I have to do some supplementations, but I didn't. And my blood tests are perfect. The baby is developing really great. I have a lot of energy. I work all the day. So I'm so happy with this lifestyle that I promote it also with my patients.
Well, that's interesting. Just out of curiosity, Bolivia, it's, I guess, adjacent to Paraguay and Brazil. And I know particularly southern Brazil, Argentina are very much, or had been traditionally, meat centric. What is the food culture in Bolivia like? Is it a very meat heavy diet, or is it more, I don't know, plant-based?
That's interesting because here in Bolivia, we have our ancestors ate a lot of meat, not just meat, liver, heart, foods that the whole animal. So yes, we are a lot of carnivores here. But of course, the last years we're seeing the change of that the meat is bad, the meat is not healthy. That I'm seeing patients that they are not eating a lot of meat. But like, for example, my grandma, she cooked with lard in her when she was adult. Since the last years, they changed to industrialized oils. But yes, we are a lot of meat eaters. And I must tell you, the quality of meat here in Bolivia is really delicious. It's better than in Argentina and Brazil. And the most interesting thing here is that when you go into the market, the cheapest meat is the grass-fed and the grass-finished. So it's cheaper than the grain-fed meat. So you can go to the market and you can find daily not just the good quality of the meat, but brain, heart, liver, kidney. So I think as a carnivore here, we're really blessed for the quality of the meat and in a cheaper price too.
Yeah, it's, a lot of people, they for whatever reason, they like the grain finish because it has more fat and they may feel like has more flavor, and that maybe that's more expensive over there. So you adopted this sort of way of eating a while ago, and have you had any negatives, any problems? I mean, you're 8 months pregnant. You can't tell from your head, but yeah, you don't look swollen or anything like that. Some people, when they're very advanced pregnancy, they sometimes have issues, but no problems with the diet since you started.
No, not at all negative issues. It was some changes, for example, that they were interesting when I made the transitions. Like for example, I realized when I came back to eat meat, and really we just ate meat, beef, eggs, liver, and water and salt for a year and 10 months, because my husband and I wanted to do some trials with our health, and that's why we were searching for that. But what's interesting, when I started to eat more meat, I have a really pain in my gums, because of course I just eat vegetables, so I felt even my teeth were not able to chew the meat. But, of course, that was because I was doing that transition. But since I went carnivore, I actually feel better, had a lot of energy. In the pandemic time, when we were really carnivore 100%, it was very interesting, because we attended a lot of COVID patients, between 20 and 50 patients per day. And it was a heavy work between 8 a.m. to 10 p.m. And just eating meat, we had a lot of energy. It was amazing. And also, I attended those patients without mask, only with my doctor's clothes, and I was with great help. And I even have time the weekends to do some workouts. So the carnivore diet, I think, is really great to enhance our health in general.
Yeah, I mean, it's certainly, it seems like when you eat healthy nutrition, it makes sense your immune system would be healthier. I mean, that's just a kind of common sense thing. I don't think it's that controversial. As far as your practice goes, so now you are actually utilizing low carb diets, keto diets, carnivore diets with your patients. Is that fair to say?
Yes, it's interesting. Of course, I would like every patient will try the carnivore diet for at least 3 months, 6 months to see the health benefits. But not all the patients are agree with that, or they like get suspicious, or like thinking I'm kind of crazy. But I really have some great experience that taking out, of course, the industrialized products, the oil, all of the sodas, the bread, and I guide them to eat at least half of the plate with a good piece of meat. And you can. I said to my patients, you can put some little carbohydrates, some veggies if you like, but at least half of your plate must be a protein. And it's interesting because here in the clinic that I work, we made a test that is called bioimpedanciometry. I don't know if it's that correct, but it's a test that can evaluate the muscle mass of the patient, the composition.
Yeah.
And it's really interesting to see that the 95%, 98% of the people that I see in my consultation, young people, old people, are really with low muscle and a lot of fat, even though they look healthy, they look skin, but they are with very little muscle. So of course, I with that test, I show them you need more protein in your diet, because protein is you have to Of course, we have to do exercise. It's really important for our health. But primarily, I said to them, they have to eat meat to get more muscle.
Yeah, we do see a lot of, there's this sort of an, we are very aware of the obesity epidemic, probably more here in the US and perhaps Bolivia, but when we see all that, but equally we have a sort of an epidemic of people that are under muscled, and it's an important thing for just not just function, but overall health, I think. So what, is there a way, do you see some conditions responding more favorably to carnivore versus, say, a ketogenic diet? Is there sort of a way you would say this is going to be more likely to be beneficial from carnivore and this ketogenic diet would be sufficient for?
I see patients here with metabolic syndrome, sarcopenia, autism, autoimmune conditions, and I see allergies. I see improvement in all of those conditions. Actually, I don't have a patient that not got better in introducing protein in their diet. Even I have patients with kidneys problem that is a concern when they eat protein, but I see great results with a keto carnivore diet in those patients.
Yeah, I think the fear of protein harming the kidneys is, hopefully people are realizing that's really unfounded, as we see actually a lot of people with chronic kidney disease actually improve when you increase protein and particularly meat in the diet, which is what we, I guess incorrectly thought it was a problem from years ago. So you say other people in the community think you're crazy. Do you have other physicians you work with within a practice, or you solo practice? Does anybody else say, what do you do? This is kind of weird. What are you doing? How does that work with your community?
Yes. At the beginning, 3 years ago or 4 years ago, yes, it was like I was kind of crazy, and I was working alone at that time. But now with more information, with more good information available, I can share that with my patients. And now I work with a doctor. She helped me with the treatments here and the patient. And we do some education with all of the people that work with us, the nurses, the reception people, because we're committed with that. We saw the good changes, and we want all the team to lead our patients into that field. So we have some. Well, when I started to the carnivore diet, my patients thought I was kind of crazy. So I started doing some videos for them, like explaining how it wouldn't damage the kidneys, how uric acid is not related to meat, a lot of Spanish videos. So because it was common questions that patients had. So if I got to explain to them, they were more acceptable. But now the patients that are coming to the clinic, they have more information. They are reading a little bit more. And also here we had in the waiting room a place that we put a lot of studies, books. That is your carnivore book there. So we have to show them that it's not crazy, because and I started talking with my patients, look how we were as humans before. And those things start to make sense to them. So they're able to, let's try first to take the bread, the sodas, and with some patients, it's more not too extreme. But, I have a patient that it was really interesting to see her case. She was taking like 13 pills and doing a almost vegetarian diet. And I proposed to her, 74 years. And I proposed to her, do you want to try a carnivore? Because she was having like 20 to 25 diarrheas per day. So I said to her, let's try it. Do you want to try? And she accepted a 74 4-year-old. And, now she's more like low carb keto carnivore 2 years from that. And she goes to the bathroom like 2 times and now taking 6 to 7 pills. But it's really amazing to see that results in the patients. And now I work also with 2 nutritionists. It was difficult to find because, well, all of the education we have, it's of course directed to treat, not to cure, not to find the root cause. So I found 2 nutritionists that were studying a lot, were into this carnivore keto diet, and now we work as a team to guide our patients into that path.
Yeah. So since 2019, you've been experimenting with carnivore, and you probably started your patients somewhat after. So prior to that, I guess maybe 2017, as you were practicing, how has the practice changed? Are you taking people off a lot more pills? You mentioned the one lady where she came from 13 down to 6 or 7. Is it a different way of practicing now, and how does it feel for you?
Actually, I must say that now I feel really happy, because when I graduated, it was like the patient came to me and I have a headache, I have arthritis, and okay, you have to take this pill, this other pill, and I don't have nothing else to do. And was seeing not improvements in those patients, and often in my health, because I was really sick. And now when I started to use this practice, not only with the food, but also with ozone therapies, power infusions with IV vitamins. And it was really satisfying because patients came back saying, I feel better. Look, I just not feel better, I lose weight. I'm feeling better, so I didn't take today my pill. So today is really satisfying. I said that I think that now I find this way of health, way of living. I want all of the patients to take this way, because yes, there's some patients that is more difficult to take out the pills. The body is really damaged, or even though the patients have the difficult to follow this path because it doesn't have the family to help them, but using the nutrition and using the therapies to regenerate the body, like the ones we use here, I'm seeing like great results. Even I must say that I don't talk to my patients as a cure. I talk to them as a reversion, because I told them, if you take the other things you do before you got sick, the disease will come back. But if we talk as a reversion, because if you stay in this lifestyle, if you stay with these treatments to regenerate your body, you will still there. So it's really satisfying for me, because of course we as a physician study to help people, not to just treat symptoms. So I find this way like really satisfying as a doctor.
Now would you say you were in Santa Cruz or somewhere near there?
Yes, my town is called Santa Cruz.
Okay.
And yes, in Bolivia.
Okay, so it's one of the bigger cities in Bolivia. So it's not a small town where you see your patients out in town, do you? You don't run into them very often, do you?
Yes, we Santa Cruz has about more than 2 million people. And it's interesting because with all of this that happened the last 2 years, that most of people realize that the immune system, it's how we are inside to have a great immune system. People are searching for this path of searching for health. So this last year, I must say, I had a lot of more patients that want to do some prevention, of heard that we can reverse some disease. And it's interesting because I have a lot of anecdotes from patients. For example, I had a 70-year-old diabetic hypertension patient that started to do a keto carnivore diet, started to do the treatments we do here. And after 6 months, She had like a crisis that they got to get her into the emergency room. And the cardiologist says, well, it's you go to the emergency room because your pills are not doing for you. Your heart is getting better. You have more strain in your heart. So we have to take out pills. And the doctor was like, he couldn't believe that she was getting better or reversing or taking those pills. So that it's really interesting because we had I wouldn't say a daily basis testimony, but per week we had minimum a patient that take out one pill or actually are feeling much better with this approach we're using.
Do you see a lot of diabetics in the clinic? Are you seeing big improvements with diabetics?
Yes. Yes, we see diabetic patients, and I'm surprised because I had patients with 15, 16 already diabetics or insulin resistance. And I look behind and see in my school, I didn't have any diabetic when I was in school. But now we're seeing this reality in patients, diabetic kids. I'm seeing also a rise in autism a lot here, and they got really a lot better with a keto carnivore approach.
Yeah, it's interesting. And I've seen a lot of people commenting on the fact that changing diet does have an impact on autism and certainly diabetes. What about other mental health issues, depression, anxiety, bipolar disorder? Do you see much of that? And do you see diet have an impact there?
Yes. In depression, panic attack, I'm seeing a lot also this year. Depression, anxiety are rising in people into 25 to 35 years. I'm seeing a lot of rise of those conditions. And yes, definitely a lot of improvement because most of people are getting out of a high carb industrialized, so they are really anxious. The first, second week, they have that syndrome that like you're quitting a drug. So we here try to educate a lot of those patients with information showing like, look, your brain look like if you were leaving a drug because you're leaving sugar, and how the protein will get better into your brain. So I think that it's not only to guide the patient how they have to eat, but explaining how it will improve and how is the mechanism that works. And it's better for them to get improved. But yes, in anxiety, panic attack, I'm seeing a lot of improvements. And of course, that is one of the strategies that we use, the nutrition. But we also combine with the treatment we do here. And I see when we do the treatments like ozone therapy, IV. Now we're using infrared light also the last year to enhance that recover. I'm seeing like faster recovery in the patients. And it's amazing when they are really combined using the diet also as a strategy.
Let me, with just because I'm not familiar with Bolivia very much, what kind of meats are popular there? Is it beef? Is it pork? Is it chicken? What if I go to Bolivia? I mean, I don't know if you know something called cuy, which I had when I was in Peru, which is actually kind of guinea pig, which was kind of unusual. But what are the traditional dishes there, which would be meat based in Bolivia?
Yes, you definitely will love here because the meat is delicious, and we eat a lot of beef. Ruminant is the primary here in Santa Cruz, where I live. People love to eat barbecues with beefs. Yes, we have pigs and chicken too, but the primary we use is ruminant. I don't know if
ruminant.
That
sure. Yeah.
Yes.
Cattle and sheep and things like. I don't know if you have much lamb there.
Cattle.
No alpaca or anything like that.
In a region from Bolivia, near Peru, yes, they eat some llama, alpaca, but here where I live, it's more cattle. Yes, more cattle.
Okay. And as far as, like I said, you mentioned some of these other things, ozone therapy, IV vitamin infusions. How often do you use that? Is that something you use for special cases, or how do you determine who gets those things?
Yes, it depends. It depends on the case. For example, if I had a patient that is an athlete patient, I'm seeing that athletes had a lot of stress in their body. So we use this therapy as a hack, like let's say to enhance the body, to adapt better the body to stress. Because what I see is, of course, nutrition is the primary approach that all of the patients needs. The other things like ozone, like PRP, like platelet-rich plasma that we use is to stimulate the regeneration. So I told to my patients, if you want to do it faster, you can use the other treatments we had here in the clinic. But if you just want to do let's say the cheapest way, just do the nutrition and you will be healthy. So the treatments, what they do is to get to the results a little faster than just only the nutrition will. So it depends on the case. For example, in acacia patients, we use a lot of keto approaches and the ozone therapies. For example, interesting. I have some patients that are sarcopenic, 80 years, 85 years, that are really with pain in the joints. I don't have to tell those patients to go to do exercise because they are inflamed. So I work with some IV amino acids. I use a lot of amino acids IV because it's nutrition. In the first step with older people, because we have to take some enzymes before they can absorb all of the meat nutrition. So we use IV therapies. Also, I have some patients that came here in a wheelchair that don't have the strength. And we use, of course, the diet, but also amino acids, IV or intramuscular, to enhance the acceleration of building muscle. Of course, that we can use also in fitness, but the patients I see the most are those with sarcopenia and having a great results in that cases. So it depends of the cases, the damage that the patients have. I would take them.
And have you had, like people come to you, these older patients, have you seen them improve, put on muscle and become more functional?
Yes, actually, I have a really interesting case of a patient that was medicated with corticoids for like 7 years. And she couldn't do even take a bath alone. She was always with someone. She came here in a wheelchair, and through a year we made the treatment, of course, with the diet, with a keto carnivore diet and with the injections. And now she came here without any help. She can take a bath. She can go, because she had a terrible life, because she always have to be with someone that takes her to the bathroom, that cleans her. And after a year, she could do her things alone. So the treatment, the IV treatments we use or the clinical treatments will go until the patient get regenerated or we see a great result, and we just that's the time. For example, the patient got into a point that can do their things or reverse the disease, so they don't need anymore those treatment, but still with the lifestyle, low carb, keto, carnivore.
And do you, I mean, because one of the concerns people talk about when you put somebody on a carnivore diet or even a ketogenic diet, there's a lot of saturated fat, and that some people think that increases the risk for heart disease. How do you deal with that particular concern?
I explained I had a TV here in my consultation that I explained to them because, yes, we see a lot of high cholesterol, but we see sometimes the cholesterol that are high because the patient is really stressed. So I explained it's not bad. It's maybe your cortisol is high, and that's why your cholesterol is high. Or like a woman that is getting into the menopause, you are taking your cholesterol. Your cholesterol is more high because you're having an hormone imbalance. And I really try to explain them that cholesterol is not bad for our health. If it's higher, like in a level that they got worried, and I try to figure it out. Why is that patient really stressed out? Is they're having a hormone imbalance? But I always try to explain them the why is not normal, let's say. Of course, I also tell them that the values that we use today are not the correct values for as we use, because when I was, for example, when I was in med school, the value for cholesterol was 220 to 240, and now I came with a range of you have to have lower than 190. So I tell them that doesn't make sense. I really try to explain that in my consultation and have some videos to educate the patients. I have some books also. So I try to actually explain them and why it's dangerous to have lower cholesterol, because I have some patient, a woman that came to my consultation that was taking statins for 7 years, and she had terrible memory problems. She was sitting in front of me and was talking, and then she forgot what she was talking. And of course, 7 years taking statins, there will be a damage, a serious damage in some way in your body. So I try to explain that to my patients. And at the beginning, they want to measure their cholesterol at the beginning of the diet, like every 2 months or every 3 months. But I try to relax them and say, no, let's measure in a 6 months, in a 10th month, because yes, you can. I see in my practice that it can, in some cases, got high, in some cases got low, but I prefer to measure after 6 or 10 months after they change their lifestyle.
Do you have other like physicians that you can be like endocrinologists or cardiologists that are upset by what you're doing? Does anybody in the community give you trouble?
Well, yes, I have some patients that tell me, well, I went to my cardiologist and said you will give me a heart attack, and or the endocrinologist says that no, the keto diet is really dangerous. That doctor doesn't know what she's talking about, but it's interesting because when I explain to the patients, the logic is there's a lot of logic in what we do in this lifestyle. So they started to realize, oh yes, and as we have now a lot of information, good information in Spanish information, also a lot of doctors, not from Bolivia, but from Argentina, from Mexico, Colombia, that taking this approach. So I share them the videos, and the patients are more open-minded today. Of course, the other doctors, I said, he or she just stay with what she or he learned from the specialty. But it's interesting, but those doctors even measure the insulin, doesn't even measure basic things to see how the metabolic is the patient. So and we do some functional tests here that can measure how you are aging, how stressed is your body, how your body is responding to that stress. And of course, after 6 months or a year that we made another measure with that, the patients are seeing results, they're feeling better. So I think that when they feel better, they continue with this.
Again, you mentioned something, you have tests that you can measure aging. how do you do? I mean, some you can just look at somebody and say they look older, but how do you measure aging?
We have some tests here that are called, for example, MDA, that is with a reactive. We measure the, I don't know how does it says in English, but peroxidación lipídica, how your
lipid peroxidation.
Yeah. We measure with that, with the MDA in the urine. Other measure we have is the blood in the microscope, the quality of the cells of the patients. We also measure the microbiome if the patient had a dysbiosis. And we also use the vitamin C, because I see a lot of patients with deficiency of vitamin C, but because nowadays lives are really stressful. And we have another test that is called adrenal test that measure your adrenal gland. So all of those results can say how you are aging, or if you are aging more than. Of course, there's people that are thin, that look young, but inside we're seeing a lot of oxidative stress, peroxidation. So that are some measures that we use to see how is the cellular health of the patients.
When you recommend a carnivore diet, a lot of times it's low fiber or no fiber diet. Are you concerned about fiber in the diet causing, digestive issues, or not having fiber in the diet? What are you actually seeing clinically?
If I had some that is a daily basis, allergies, gut issues, irritable bowel syndrome, I don't go with the fiber when I talk to my patients, because I see better results when they really low fiber. I go with the path saying a lot of not only the anti-nutrients that the plant have, but also the pesticides. There are a lot of pesticides in the veggies, and there is also a test that can measure if you are inflamed, if you are a lot of oxalates, if you can digest fiber. And I use that test to show the patients that their gut are inflamed, and we have to remove those anti-nutrients. So, but I leave them with, for example, some the keto ones, but the most that have, for example, autoimmune, depression, anxiety, we prefer to take more keto carnivore, low fiber and low veggies, and it goes really, really, really good.
Yeah, it's interesting because what you see, the actual clinical experience, which is often different from what we're often told. Are you, as far as Bolivia is concerned, are there other low-carb carnivore doctors in that? Or are you the only one there? I don't know.
I had a lot of doctor friends that are now getting the approach of low carb, gluten-free, but actually, yes, starting with that. A lot of my doctor friends says when I was carnivore that I was kind of crazy. How come? And my husband and I were like a year and 10 months only eating beef, eggs, water, salt. And yes, we proved that really that helps a lot of our health. And now they see us and they said, oh, I'm eating more meat, or I'm taking less bread, but it's difficult. But there's a lot of medicals, doctors that are taking the low carb approach, not the keto and carnivore, but yes, getting into low carb approach.
Yeah, that's interesting to see, and it's good to see it spreading. Obviously there's people that are going more plant-based. That's certainly been out there. That's been pushed very heavily by media, at least here. I don't know what it's like in Bolivia. Is there, it's interesting. We have a national dietary guidelines, which talk about limiting saturated fat and added sugar and eating lots of, grains and fruits and vegetables, and meat should be a small part of the meal, and on and on and on. Does Bolivia have a national guidelines? I know Brazil has something which is more just eat at home and don't eat processed food, which I think is more, in line with what's actually helpful. But does Bolivia have a national guidelines? Do they follow the American guidelines, or where does Bolivia fall in their recommendations nationally?
Yes, we follow the American guidelines. That's what the nutritionists are. Well, the guide they have is the American. But we made some videos for our patients telling that is a lie, that they've been lying to us a lot of time. We show statistics with how now we're seeing more diabetes, hypertension, even more diseases in younger ages. And when we all of us here talk to the patients, I tell them what we have to eat as we are formed of. Like, my hair is protein, my skin is protein, my brain is fat and protein, my bones are protein, my muscle are protein. So we must eat as we are made of. Like, if you want to construct a house, a strong house, you won't use wood. You will use the other elements to make a stronger house. So if you want to have a stronger body, you have to eat protein, because is that what you're formed of. And yes, and we made our pyramid. That is a carnivore pyramid, that in the bases for our patients are the animals, the eggs. And yes, that's what we do here. And we are so with my husband, because he helped me to manage the medical center. We are so committed with the health, because we see so improvements not only in our health, in our father's health, in our family, because they adopt this lifestyle, that we have some natural products that we share with our patients. Like, for example, we made some jelly with food cows that are really delicious, with coconut flavor, and the patients love that, and it's pure protein. We made some ghee butter for our patients. So we are in the mission that we have to give the patient all of they need, the information, the food that they need, because eating healthy here, it's I don't know how it says, but it's here the eating healthy is eating plant-based. It's now with that arising here. So you go to the market that sells healthy products, but they're not healthy. They are with oils, they're industrialized, and don't have meat. So we are fighting with that also with our own products.
And you aren't seeing a big push to consume insects there in Bolivia, are you? I know there's some push that we want to eat crickets and things like that.
That doesn't came here yet.
Good for
I
you.
hope it doesn't.
Yeah, I hope not either. Well, I'll tell you, unfortunately, we're running out of time now. But Dr. Lopez, thank you so much for taking the time to talk with us, and thank you for doing what you're doing in Bolivia. It's great to see this spreading out throughout the world. If somebody wants to find you either on social media or visit you in their clinic, how do they get a hold of you?
Yes. Well, thank you. Actually, I'm a big fan of you, and I'm actually part of the Revero's community. I also been a coach when we were Meet RX. Mm-hmm. So I'm really happy to be here. And I do some work in the social media, in Instagram and in YouTube with videos. In YouTube, you'll find me as Doctora Fernanda Lopez. And in Instagram, I am with Nanda _L. And there I share a lot of videos. I also share what I eat every day, every breakfast, every lunch, what I eat. I take a photo and put it into my social media, because I want to share what I eat, so people or patients can see what is healthy and have some ideas also.
Wonderful. And 8 months pregnant, do you know, boy, girl? Do you know what you're having? Is this first one, or what number is this?
Yes, is the first one. Will be wonderful. A girl.
Congratulations. Wonderful. Good luck with the upcoming delivery, and I'm sure you're going to have a happy, healthy little baby, and hopefully feed a little baby with lots of good food. And thank you so much.
Definitely.
Okay.
Thank you so much. I'm really happy to be here talking with you. And yes, we are together in this mission.
Thank you. And appreciate it. Okay. Goodbye. Thanks, everybody. We'll see you guys back tomorrow. Thanks, everybody. Bye-bye now.